Hey, it's Dr. Brian McKay of Core Health in Darien, and today I'd like to speak to you about a really effective way of treating back pain that we use here at Core Health in Darien. It's called laser, cold laser, low level laser, also called photobiomodulation. Any way you call it, any way you name it, it's basically a laser. And lasers kind of were invented by, for therapy was about 1967 by a guy named Andre Mester at the Semmelweis Medical University in Hungary. Now, a lot of times these medical treatments that don't involve medication will come out of Europe because they have a different cost structure over there. There really is no incentive for the pharmaceutical companies to promote low level laser therapy because they can't profit from it. As a result, there's the studies aren't as many studies. They don't have to prove the efficacy. But here's the thing: it's been around for a long time, and what I want to do is I want to focus on how back pain is affected with the laser. And the laser basically improves circulation. So the light energy, just like photosynthesis, you have light energy that comes into the body in packets of energy called photons. That's where the photobiomodulation part comes in, and it actually allows the water molecules to speed up. So it's enhanced. So the light is energy, and so that therefore speeds up microcirculation. So if you have a damaged body part and you're getting more blood flow to the area, it's going to heal a hell of a lot quicker. So that's a good thing. I mean, I think so at least. Um, but basically, just understand how lasers improve circulation. They support cellular health. Now, when a cell is not working properly, you're going to have issues. So the laser also helps stimulate in the mitochondria, which is an organelle within the cell that produces energy. And the energy is produced is called ATP, it's adenosine triphosphate. So you got improved circulation, better cell health. Now, it also releases the endorphins. Those are the body's natural painkillers, and then also reduces inflammation and encourages the growth of new healthy tissue. So you really can't lose with laser, okay? So there's several, there's several mechanisms of action. Um, the increased microcirculation due to the stimulation of water molecules um, will help dilate the blood vessel and also helps increase production of nitric oxide. Nitric oxide is a powerful vasodilator that we can produce, but as we age, we produce less of it. Um, so that's one of the key couple key things. Better cell health, increased production of nitric oxide, circulation is enhanced. So we got a lot of stuff going on here that's all positive for the most part. Now, chronic lower back pain is always accompanied by inflammation, and laser therapy will allow the inflammation in the tissue to heal more efficiently and actually faster. So if we want to get a little more technical, the laser therapy also, one of the mechanisms of pain reduction, it suppresses the conduction velocity of the nerve and the amplitude of the firing of that the nerve fires at. And so this decreases your sensitivity because people with a chronic low back pain have increased sensitivity. It's called allodynia. So people are more sensitive than they would be to pain stimulus or even touching. So there's a lot of science behind laser therapy. So the low back patient will benefit nicely, especially in the early stage of care, from the production of the body's natural endorphins. These are natural painkillers, and those painkillers work by binding to the opioid receptors in your brain to block the perception of pain, resulting in less pain. So again, all pretty much a win-win. There are some downsides for laser therapy. Got to be careful. The doctor's eyes got to be shielded, and the patients, if they as well. The laser is very powerful and can do some damage to the eye structure. So you just prepare and prep properly, and there shouldn't be any issues. Now, the other thing you want to be careful is you don't want to burn the patient. And I'm going to tell you an anecdotal story. One time I was treating a patient for migraine headaches, and all of a sudden, the patient's hair started to smoke. I was like, "Whoa!" This was turns out she had too much hairspray on. The hair didn't go on fire, but it did start seeing smoke, and so it was, luckily for me, the patient was not burned, but it was definitely a lesson to be learned. So, like many conditions, lower back pain can be helped with the use of photobiomodulation or laser. The new term photobiomodulation, I don't think you're allowed to bill anymore for it, but everybody wants themselves to sound more important, but it is basically laser. The good thing is the treatment only takes a few minutes, and quite often the patient is going to feel immediate results. Most chiropractors and physical therapists are opting for laser therapy to get better and fast results for their patients. So if you have a low back issue, I suggest you call your doctor or therapist, see if they have it before you make the appointment, because you will feel that much better that much sooner. We do it here in our office. If you've got any questions, I want you to feel free to give me a call. My number is 203-656-3636. 203-656-3636. Core Health Area is located at 551 Post Road. We treat a lot of bad backs, and I think we do a pretty darn good job of it. Laser is only one part of our arsenal for really treating a low back and getting it some solid results. So I hope you learned a little bit about laser or photobiomodulation, also known as low-level laser. And hopefully, if you have back pain, you'll see some benefit if you use it. Dr. Brian McKay, I want to thank you for listening.